So hello, everyone. I'm Melissa Secor, the National Executive Director for the Canadian Celiac Association, and today I'm joined by Janet Bolton, our volunteer president. Welcome, Janet.
Thanks, Melissa. Nice to connect with you. I love the sunflowers behind you. It's just beautiful.
Thank you. Well, we've been really blessed this year to have some support from some great families, including the Davis Family Farm, and we're just winding down our sunflower campaign where people have been buying packages of sunflower seeds in support of CCA. So we're really thrilled. So I just love having these sunflowers surrounding me, all this sunny stuff, warming my heart. Today we're joined together just to give everyone an update on what CCA is doing on behalf of the celiac community. It's Celiac Awareness Month, and it's no better time to let everyone know about the hard work that's going on behind the scenes and also, out in our social media that a lot of people see. So Janet, just love for you to share an update on CCA's National Board Strategic Priorities for the year.
Sure, I'd love to. I will say that we adopted a new strategic plan in February of 2020 and just before the global pandemic hit. And luckily, the elements of that plan have held true through the pandemic, but our old strategic plan had focused on access to safe food, awareness, quality of life diagnosis, and organizational strength. And most of those we carried forward. One thing we put a bit more focus on this time around was the putting science first. CCA has always been a science-based organization, and we really felt that's one of its real strengths. So we wanted to make that an explicit priority. We are so lucky to work with an amazing professional advisory council, which helps us stay on top of research, which conducts its own research, and we strive to do more in this area. I want everyone to know we just moved $30,000 into the J.A. Campbell Research Fund. This is a fund that was established by a very, very generous donor in 2000, and it distributes grants for research projects related to celiac disease, dermatitis herpetiformis, or non-celiac gluten sensitivity. We're also partnering for the first time with some pharma companies who are bringing clinical trials to Canada, and I can't tell you how important that is to my family, and I'm sure to many of our many people in our community, because celiac disease doesn't end with the gluten-free diet. Our own research is showing people are still consuming small amounts of gluten despite best efforts, and we continue to identify projects that move us toward new treatments and discovery models and projects that can help supplement the diet and improve quality of care and management.
Yeah, we've certainly been lucky on our J.A. Campbell Fund because we've been able to fund projects that start new researchers on a new path to looking at celiac diagnosis and celiac research. People like Elena Verdu and Jocelyn Sylvester got their first starts with a J.A. Campbell grant, and now they're seen as some of the leading researchers around the world. So it's pretty amazing, these donations, what they can do, because they've really pushed forward the research that's happening in celiac, whether it's mouse models, discoveries of new the microbiota, which is really important and is being looked at. So our donors and past supporters should be really quite proud of the research that's come out of the funding of the J.A. Campbell Fund.
Absolutely, absolutely. Now, switching gears a little bit, you and your team of volunteers from our dietitian working group have been really busy behind the scenes working on advocacy, and that also aligns to our strat plan. Did you want to speak about that, Melissa?
Sure, definitely. We're working on strengthening standards, improving access to safe food, and CCA has been a champion of that for years, since really leading the labeling change about 10 years ago. But it doesn't end there. We've been advocating for food safety. In the past year, we've been active on a number of fronts. We recently made a submission to the Canadian Grains Act review, and we're looking at the research into the growing, handling, transportation, and processing of gluten-free grains and pulses and lentils and gluten-free oats to better protect consumers. We've been actively also pursuing food safety through the COVID pandemic with the global food supply chains being stretched, and we fought to ensure there are no compromises to gluten-free labeling. And we've been actively meeting with Health Canada to advocate for improved labeling, such as the precautionary labeling that may contains that everybody dreads. And we're partnering with them directly on actively monitoring online food sales and the gaps in regulations that we're finding. And that's been even heightened through COVID. So we've been actively speaking with them there. And we've also started to talk about fortification of gluten-free foods. And even we successfully advocated with Health Canada and CFIA to do some active food surveillance studies to assess the levels of glutens in products like nuts and pulses. And we'll be working with them on reviewing new products such as oat milk, which is quite popular now and seen as an alternative for people who may be still lactose intolerant. And our vision is to have every Canadian with celiac disease diagnosed and empowered. And so with that, you'll be seeing, as we pass through COVID and the medical community gets back to the old normal, we'll be doing more specific medical awareness to get Canadians diagnosed faster. Right now, it's still 9.6 years from the time of first signs to when they get to a diagnosis. And we want to close the gap. And finally, as part of that, we will be ramping up as Ontario heads to a provincial election next June to advocate for the primary OHIP funding for the IgA TGG blood test in Ontario. So we've been really busy this month, Janet. It's, as I said at the top, it's Celiac Awareness Month. And what would you say that bringing awareness means to you?
I think awareness is something that crosses a number of different stakeholder groups. So, one of the continuing themes for the board is, how do we raise awareness in the healthcare community? How do we raise awareness in the food service community? I know back in February 2020, we were worrying about restaurants, and now, that is obviously a really important sector, but harder to work with through COVID. So, just making sure people have the knowledge they know, for example, just to avoid inadvertent cross-contamination in the preparation of food. We didn't know back in February 2020 that food security was going to become such a big issue. Certainly there were issues with supply chains and also just a lot of people economically impacted by COVID. And we're proud to be working to promote gluten-free food donations to food banks and also to educate food bank staff about saving gluten-free food for those who need to follow a gluten-free diet. I've personally gone down a couple times with bags of Save Me for Gluten-Free. That label is available, I believe, on our website. Is that right, Melissa?
It is, and I've taken some product down to my local food bank, and it's amazing when you're talking with local workers. I personally met with a volunteer for the food bank in Georgetown, Ontario, who his family is celiac, and he was just really thrilled to be seeing this initiative coming forward.
Well, that's great. I think one thing we have where we have room to improve as an organization is really reaching out to different cultural communities in Canada, different socioeconomic communities in Canada, and I would say that that's really on the board's radar. We're really pushing to learn what we need to learn, because it is a journey, and to make the connections we need to really make sure we're representing all Canadians who are impacted by celiac disease or gluten disorders.
We're really actually thrilled to be launching an initiative in June in partnership with Takeda and Breadables, where we'll be featuring two portals, sort of a part of our website. One is going to be in Punjabi Urdu, and the other one will be in Arabic. And we're going to be offering some new resources, our now newly translated into Punjabi and Arabic, our Living Gluten-Free document that gets people started on the gluten-free diet once diagnosed, and also what is celiac. And we're also going to be hosting a webinar the very first time, all in Urdu, in early June, and it'll be featuring Dr. Mohsin Rashid, a gastroenterologist out of Nova Scotia. And Gori Bawa, people may recognize her name. She was our dietitian who started us off on our help desk for the past couple of years. She will also be participating as a dietitian, and it's going to be a really great opportunity. And then we're hoping to do the same for the Arabic community. So we're really trying to reach new audiences, to make sure they're aware of the disease and to get the help that they need.
That's so great. I'm just, the board has trouble keeping up with all of the work that Melissa's team is doing. So I'm actually learning things in this interview. I'm really proud to say that although COVID sort of surprised us all and set us back, that we actually used it to our advantage, and we ran 2 very successful online conferences, and we were able to reach more people in Canada and internationally than we've ever reached before at one of our conferences, and we were able to bring some members of our professional advisory council and leading scientists, leading advisors to speak broadly to this online audience. And I'm really happy with our reach, and I think that's kind of sets us on a new path for our next conference as well.
Definitely. And yeah, and this fall we're going to be changing up just a little bit. We're going to be offering 2 streams in November, on November 13th and 14th. So we're going to have one day for the newbies and those just discovering celiac disease, just doing the introduction to the gluten-free diet, even some basics to travel, eating out, and really focus that stream. And then on the second day, it'll be for our master class of those who are already empowered, experienced celiacs, and also gearing to health professionals like dietitians and physicians, but going a deeper dive, a little bit more into the research of where things are going. And we're looking forward to a really great turnout again this fall.
Oh, that's fantastic. And I think I'll end up attending both streams, I hope. It's actually the middle of Celiac Awareness Month right now, and I know by the time we post this, probably the entire country will have been painted green, but I'm personally looking forward to seeing the CN Tower in Toronto light up green on Sunday. And I know that we have chapters across the country and support groups across the country and volunteers across the country who've really engaged with Celiac Awareness Month, and also throughout the year in fundraising. I wondered, and getting their own local landmarks, I'll say painted green, but really lit green. I'm wondering if you wanted to comment on some of the people or some of the groups that have been involved this month, Melissa.
Well, and this year, for the second year in a row, CCA has actually led the international community in creating more of really making the International Day a collective voice and having a common hashtag, shine a light on celiac. So we're really thrilled that we've been able to bring in together North American partners, international partners in Greece, in Slovakia, in the UK, Australia, our US partners. So we're really, it is a small disease group compared to some of the other, charities and sectors. So it's really great to have everybody come along. But we're really thrilled that we've had some individuals be so passionate about Celiac Awareness Month this year that they've gone out and, contacted their local, in Saskatoon, their local landmarks and cities to try and raise awareness. Even just more locally here in Ontario, where I am. We had a mom, Lindsay, reach out on behalf of her 4-year-old to the city of Cambridge, and now they're lighting up their bridges and towers green for celiac. So it's really amazing to see, people coming forward. We've got a young Amy who's on Twitch, who's on that gaming platform. She's been raising some money for us during Celiac Month on her online gaming community. It's really kind of cool to see that. We've had birthday celebrations helping us raise money. We've even have someone walking or running 50 kilometers this month and raising awareness and collecting donations. So we really, really, truly are very grateful. CCA National is a small charity by, compared to some of the large ones out there. And we maximize every dollar. Only 17% of our of every dollar goes to overhead, and otherwise it's all into programming to support the newly diagnosed, through our client support desk, our peer supporters, our free education that we offer, the materials and resources. And we're really grateful for the sponsors that have come forward, as well as the donor community that help us help the broader community. And so I want to thank this month Promise Gluten-Free, who's been for the third year in a row our lead partner, really leaned in. We've had Made Good come in as a first-time partner, helping us with our spring campaign. Companies like Char, Valley Flax Flour, Cup for Cup, Kinnikinnick, have also stepped in this month, and as well as Glutino with our webinar Wednesdays that we've been hosting, and I've been a Save Me for Gluten-Free campaign partner as well. I'm sure I've forgotten somebody, but just really want to thank their support for supporting the gluten-free community with safe food, but also supporting CCA in our efforts to help support the community.
Thanks, Melissa. I'd like to express the thanks of the board of directors as well, because without the generosity of those sponsors, we couldn't do nearly the amount of work that we're doing. And I'm really pleased that we've had such a broad reach this year. And I hope that everyone enjoys the Celiac Month and participates in social media, etc., so that we can raise awareness even further and start to make progress in the areas like research and diagnosis, which is really awareness is the key to diagnosis. So Melissa, just thank you to your team, and thank you to all of the volunteers, all of the chapters, all of the support groups, and all of the sponsors for the great work that is being done.
Yeah, we definitely think it does take a village to do all the work that we do. We've been saying it since the first time I came on to CCA for the first time back 4.5 years ago. It's that Helen Keller quote about, together we make a difference, right? There's only so much as one individual can do, but together, thanks to the volunteers, the PAC, the board of directors, the volunteers, the donors, the community, supporting each other, we really are together lifting more awareness and supports and helping more people than ever before. And it's very humbling, and we're very grateful. And it's nothing but growth. We're going to keep on going, and we're going to be heard and get more people helped.
And I'll be planting my sunflowers this weekend. I hope that's the right timing.
Yeah, and I hope everyone will be snapping photos of their beautiful sunflowers, coming this summer. But it's really great, fitting that we'll all be planting our seeds during Celiac Awareness Month and sowing the seeds for future success, and basically just watch us grow. Thanks a lot, Janet, for taking the time today.
Thanks, Melissa.
Thanks very much.